Good day, this is Professor McClammy here today to speak to you about antibiotics. So there's several classes of antibiotics that we'll specifically be looking at in these PowerPoints: the sulfonamides, penicillins, cephalosporins, macrolides, quinolones, aminoglycosides, and tetracyclines. Here's an example of some of the different shapes of bacteria that these antibiotics are used for. Big thing to talk about is multi-drug resistant organisms, typically because antibiotics used to be used inappropriately to treat viruses and unnecessarily. So some of these organisms are MRSA, methicillin-resistant Staph aureus, VRE, which is vancomycin-resistant enterococci, ESBL, extended spectrum beta-lactamase, and CRE is carbapenem-resistant enterobacteria. Typically MRSA, which is the most popular, used to be considered nosocomial, meaning it came from patients that were in the hospital or had invasive procedures, but now we're seeing it a lot in the community. So it's pretty common to have skin infections that are infected with MRSA. This is talking about antibiotic therapy. Empiric therapy is treatment for an infection before a specific culture, so they're usually broad spectrum that cover multiple organisms. Definitive therapy is once you know what the organism is, typically by sending a culture to the lab and it identifies it, then you give a specific antibiotic. And then prophylactic therapy is treatment with antibiotics to prevent any type of infection. So you might give it before surgery or after a trauma to prevent infection. So this is talking about sulfonamides. Bactrim is typically the prototype drug. Dosing is typically based on the trimethoprim component, which is abbreviated TMP. So when you see that, that's typically how you calculate the drug dose. This goes through and explains the mechanism of action and indications for use and contraindications for the specific medication. Let's see here. Here's some more adverse effects, interactions. You guys can read through that and just be familiar with these. So typically for these different classifications of antibiotics, just be familiar with the prototypes and do your med worksheets to kind of write it out to know typically how it's given or reconstituted, side effects, contraindications, dosing, that type of a thing. For penicillins, the prototype drug is amoxicillin. We use it very commonly first line for ear infections, strep throat, sometimes UTI, and various different skin infections. Usually well tolerated. Most kids take it well. In the liquid form, it tastes pretty good, and it is available by pill. Dosing can be once or twice a day depending on what you're treating for. And this again just talks about elimination, half-life, duration of action. So for cephalosporins, the prototype drug is Keflex. First generation, actually there's several generations of cephalosporins, and it'll kind of break it down as we go through this. Again, typically used for skin infections, UTIs. It can be used for those with penicillin allergies. There is a small percentage, I think it's 15% of patients that have penicillin allergies may also be allergic to cephalosporin. So just keep that in mind and keep the patients informed about that. It also talks about possible allergic reaction to many of these antibiotics. You're going to see hives, itching, swelling, maybe a cough, possibly vomiting, and this can happen up to 2 days after completing a full course of antibiotics and as early as after the first dose. So people need to be aware that at any point if any of these symptoms develop, they're asked to stop the medication immediately, take Benadryl if needed. If they're asthmatic, maybe use an inhaler like albuterol to help if they have any coughing or wheezing. Obviously, difficulty breathing needs to go to the emergency room. Otherwise, they can usually call the provider and let them know what symptoms they're having to see if they need to maybe get a new antibiotic, or maybe if they're at the end of the course, they could just complete the antibiotics and just monitor from there. So aminoglycosides, another class of drugs. These specifically can cause serious toxicities, ototoxicity and nephrotoxicity. Some of these you need to monitor the drug levels, do blood work prior to and during the use of these medications. Quinolones, Cipro is the most common that we typically see. Again, treats S. aureus in various organisms. There is some bacterial resistance to some of these quinolones, as well as other antibiotics that are in this PowerPoint. Cipro, typically taken PO. There are otic drops and ophthalmic drops that are available also. So, of course, before starting any medication, you always need to check if there's any type of allergies, what other medications they're on, any contraindications for use, and any possible drug interactions. If possible, before starting antibiotics, if it's for some type of injury or growth, it's best if you can send the culture prior to starting antibiotics. If it's serious, and then once you get the results back, you can continue or switch antibiotics as needed. But if you do a culture after a patient's been on antibiotics, it's not likely that it's going to pick up on the organism that we're trying to figure out what the source of the infection is.